Good.
So, welcome everyone to today's discussion. We kind of advertise it as a live discussion, but really, Dr. Kate Dowd is going to be sharing a lot of knowledge. I might ask a couple questions here and there. I don't know how much I'll have to bring to the table as far as my content. This will be more about Dr. Dowd. So, as we get started here, I just want to do a quick introduction. Dr. Kate Dowd is with Active Life. She is a physical therapist by trade, and she is also a one-on-one coach with Active Life as well as an immersion instructor. Kate, your experience goes back 14 years, I believe, in physical therapy, mostly in orthopedics and also in CrossFit. Is that right?
That is right. So thank you so much for having me on here today. It's a real privilege to be here.
Yeah, absolutely. And the perspective that you'll be coming from today is one that Active Life is, championing. And that's about kind of changing things as we know them. And you mentioned before this talk that you're not here to necessarily change anyone's mind. You're more or less here to get people to question and kind of interrogate their existing processes for how they assess athletes. And with that being
Exactly.
said, I'm going to hand it over to you and you can kind of take over from there.
Sure, sure. Well, like I said, thank you so much for having me. And really, the purpose for my discussion today is to first just get coaches thinking about what their current process really is for selecting exercises that they do in their programming with their clients, with their teams, whoever they're working with. What is really driving your current decision making? Do you cruise through Instagram looking for the coolest looking exercises? You're like, oh, let's try that. That'll be great. Or, do you always start with XYZ exercises at 2 by 10 reps because that's just how it's always been done? You haven't really taken time to put extra thought into the intention behind it. And, secondly, I want to have coaches think about, if you do have a current process, is it working for you? And if you feel like it is, how do you know? And lastly, and finally, what I want to do today is really provide a simplistic look at a way to approach athletes' current performance abilities and how to be really more intentional with the programming that they're providing and their exercise selection. So I know your viewers are certainly really thirsty for some programming knowledge and how to go about that. But really, before we get into the heart of actual programming, we really need to establish the fact that the best coaches and programmers start their process with a thorough assessment of their athletes and clients. You really need this clear picture about where they stand currently and be able to obtain real objective data that you can kind of like easily track along the way. We can take a look at that data again in 8 weeks' time and determine whether or not they're making progress and your programming is truly effective.
And just
So
to,
I know,
to jump in
yeah,
there, if we're,
yeah,
in today's world, it's very virtual. So when we talk about collecting athlete data, we're also talking about doing it in like a realistic way, like data that you can obtain from the client if you're also training them remotely versus an in-person one.
absolutely. Yeah, and the assessment process that we take our clients through, we are a virtual coaching company. We do all of our assessment process in a virtual platform. So, but it kind of makes doing it in person that much easier,
Mm.
obviously, because you're there in real time. You can take a look at that athlete's movement and be able to gather data that way. But it is not impossible, as you can see from our company and what we do for our clients, that being in a virtual situation is not a limiting factor here.
Mm.
So that's really good. Um, so, I mean, as far as the assessment process goes, I mean, I know you and I have talked a lot about kind of the processes that are out there and some of the most popular ones that we've come across. And I've used a lot of different ones over the course of my career. And kind of the one I want to touch on because I know that it's a basis for a lot of what your current coaches use is kind of surrounding that popular FMS model and that functional movement screening or some variation or a portion of it. And I can admit I've used it in my past to screen some of the local sports teams, soccer, baseball, to help identify, what are their risks for injury. And so I'm not here to bash FMS at all. It's really a great tool to use and gain some basic understanding of an athlete's ability to move and coordinate patterns. But I always had this degree of difficulty figuring out what do you do with the results, right? They go through these complex movements, it's pass or fail. You fail, why? And it doesn't really give you any direction beyond that. There's a lot of variability between observing coaches. One coach might think that they failed because, oh, well, it was for overhead flexibility. The next one may be like, you know what? No, I think it was because of their ankle. It requires if you take a look at like their overhead squat, for instance, it's a very complex move just inherently, right? So it requires the ability to achieve and maintain overhead position, requires thoracic extension, full hip flexion, knee flexion, ankle dorsiflexion, and the ability to coordinate all these levers over their center of gravity and maintain a balance. So if coaches are evaluating using FMS variations and they see, hey, that overhead squat, they feel that they have a deviation of some sort, we still don't have enough information to be able to decide what our exercise focus needs to be. It's this guessing game. So, really, what we need to do in that kind of instance, we're trying to figure out, okay, well, where do we need to focus our energy? What do they need to prioritize? And it's still this big experimentation process to figure out what intervention is going to be best to solve the problem. So, what I really want to go through today is the foundational concept of what we use at Active Life with each and every single one of our clients. Whether they come to us with complaints of pain, with overhead pressing, or whether it's something like a performance plateau, like I haven't PR'd my back squat in 2 years despite squatting 4 days a week. What gives? So, this process that we utilize is still the same in both instances. And it's really based on what we call the athlete's hierarchy of needs. So I'm going to go ahead and I'm going to share my screen. I'm going to bring up this image here. Just bear with me. Here we go. You can see that, right?
Hmm.
Okay. So the hierarchy here that I have is a systematic approach to athletic injury and performance. So it allows us the ability to determine what our lowest hanging fruits are for each athlete. So these lowest hanging fruits allow us to develop what we call a functional diagnosis, which is kind of in the title of my presentation for today. And this is what is driving our decision making in exercise selection for that client's program. So by doing this, we can be confident then that we're honing in on the areas that they really need to prioritize their efforts to get the results that they want and what we want to see as a coach for them, right? We want them to be stronger, healthier athletes. So what your coaches might be asking, well, what the heck is a functional diagnosis? Well, first off, it's not to be confused with a medical diagnosis. A medical diagnosis is what they come in like, oh, I've got a medial meniscus tear, I've got a rotator cuff tear, or a rotator cuff sprain or strain, a herniated disc, all of those medical jargon kind of terms. That's not really the purpose of a coach, right? Like, that's way out of the scope. A functional diagnosis, on the other hand, is really a description of the findings and the summary of findings in this particular hierarchy. So it could be something like a right hip flexibility restriction or a weaker right front rack step up as compared to the left. All things that are within the scope of a strength and conditioning coach. This is not a medical kind of thing. So when an athlete is weak, would you agree that it's within the scope of a coach to be able to give them exercises to make them stronger? Of course it is, right? That's why we're coaching them. We want to make them stronger, better performing athletes. So this hierarchy ends up simplifying even the most complex client situation. I give advice to my students all the time that are in immersion, learning how to program for clients, how to kind of sort through the laundry list of deficits they end up coming to me with. I'm like, oh my gosh, this person's a hot mess, right? I don't know where to start. And my number one piece of advice that I'll give is go back to your hierarchy, because going through it in this way just makes it a lot simpler, makes that process a lot more streamlined, and it also makes it more effective at approaching their programming situation. So what I want to do is go through each one of these layers. You can see they kind of build on top of each other, right? We have this base, and then we get up to that top skill level there at the top. So flexibility, you can see that's our biggest piece right down there at the bottom. So we're going to define flexibility simply as passive range of motion. So at any given joint, how much range is possible when it's put under some sort of external load? It could be gravity, it could be a handheld assist, or something extra forcing it. So an example would be, if I take my finger and I bend it back, that's how flexible my finger is, right? So that's going to be a lot different than the next step up in our ladder here in our hierarchy, which is mobility. Mobility is going to be active range of motion. So out of that range of motion that's available at a joint, how much of it can we actually utilize and control? So if this was how flexible my finger was, this is how mobile my finger is. So together, these form what we know as movement, right? However, deficits in one of them are going to be addressed a lot differently than the other. And so, a lot of times in the fitness industry, we hear these terms used interchangeably, right? They're just more flexibility training. I need more mobility. I need to do ROMWAD. I need to do all these things. But I want to distinguish between those two terms. Basically, what it comes down to is one is a range of motion availability problem, flexibility, that may require things like end range holds, eccentric loading to end range, and even potentially long term modifications of a position due to their anatomy. The other, mobility, is more of a strength problem. And what do we do when we're weak? We provide exercises that strengthen it, right? So we don't spend 15 minutes before practice hanging out on a band or stretching our hamstrings when it's a mobility issue that you actually have to make stronger. Otherwise, if you're trying to stretch a strength problem, you're not going to get the results that you're hoping for, right? So, as we move up our hierarchy, we get to that idea of strength balance. We know as coaches that joints in our body move as a result of muscle groups working together to produce that movement. So, muscle balance refers to the ability of, how well those muscle groups are producing forces in equal and opposite directions. And that's going to be able to optimize the movement they're performing at that joint. So it impacts the performance, impacts efficiency, the health of that joint. And we know that if one group is really working a lot harder than their opposite, their counterpart, then the athlete's a lot greater at risk for things like injuries. Something I think we can all agree on as coaches is that we want to do our best to prevent injuries. That's like the last thing we want to see is one of our clients or athletes going down on the field and being out for a season or having to go out of the gym for a year because now they need surgery. That's like a coach's nightmare, right? So, example of strength balance is pretty obvious. Maybe an athlete comes to you and says, "Hey, I can back squat 400 pounds. Great. And I can deadlift 300." So that's a really obvious kind of example. So hopefully this kind of perks your ears up and be like, huh, something's not quite right there, right? Those numbers should really be in the opposite direction. And we can pretty safely assume, not assume, but we can determine based on just those numbers that this is probably a very quad dominant athlete, right? And for that reason, they don't really have to be, and nor should they really be at all, doing squat pattern training 4 days a week. They're already really strong there. Why are you going to continue to drive that pattern into the ground? What they really need is more hinging. They need to do deadlifts. They need to do those hinge pattern type of movements to help correct that imbalance. So, that's a really big example, a very obvious example, that imbalance in hamstring to quad strength has been proven over and over to contribute to, high incidence of ACL tears, things like that in non-contact sports. So what we also want to consider though are kind of the less obvious imbalances. What do we look at the right leg as being able to do in a step up, for instance, versus our left leg? What do we do versus, our pull versus our press capabilities? Our single arm, a high pull versus a dumbbell press, so unilateral pattern. So taking a look at imbalances in multiple planes of movement, right? It's not just quads versus hamstrings anymore.
Just a quick question. Do you
Yeah.
see certain imbalances as being more common than others? Say, for example, with clients that come to you with very little to no training age, or people who do come in with some training age?
I would say probably one of the most common ones involves upper extremity, usually unilateral, like right to left discrepancies.
Mm.
A lot of times, especially because I do work primarily with CrossFit athletes who love doing pull ups, they love doing gymnastics work, they love doing, all of these motions that involve downward rotation of the scapula. So, pull ups, dips, all those kind of things, muscle ups, they're super cool to look at, they're super cool to perform. They're like, yeah, I'm badass, right? So, what they end up doing is they neglect the movements like a high pull that end up being a deficiency for them. They can't upwardly rotate the scapula anymore. And that then impacts the overall health of their shoulder and it just makes things all wonky. So that's probably one of the most common imbalances that I'll see is a unilateral pulling versus a pressing. In addition to like the step up is a big one. Somebody who's been having difficulty squatting, you end up taking a look at their front rack step up, which challenges a lot of different things all in one. And you'll see, oh, I could do 6 reps on my right, I could do 18 on my left. It's like, wow, that's a big imbalance. And when you start making that weaker side stronger by focusing on it, 8 weeks later, now they're starting to PR their back squat. So there's a big
Hmm.
carryover in unilateral training with specificity and having that carry over into their bilateral movements.
Yeah.
But you never would have guessed that if they were struggling with squats and you're trying to do squat, 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 squat. And really, it's under an underlying imbalance between the two legs and their ability to generate force.
Yeah.
Right. So
Cool.
you kind of have all these ideal ratios, if you will, where our abilities should lie in obviously an ideal situation that we kind of strive for, looking for somebody's ability to generate power in different directions and different planes. Yeah. So that's those are some of the most common situations though. So as we go up into the next level of the hierarchy, so we've gone through flexibility, mobility, so we've taken a look at the range of motion, we've taken a look at their strength balance, and now we get up to this volume and recovery balance, or this work recovery ratio. I think I've described it as before. This is the one level of the hierarchy that can really actually take precedence above all the other layers, even though it's kind of towards the top and it's not necessarily a big piece of the puzzle. But when it's a problem, it actually is going to be kind of the number one thing you attack. For instance, you have an athlete who's really driven in his or her training. They have the mentality that hard work, long gym hours, daily will result in their best performance, right? Like more is more. And speaking with them, you find out, they've been working out 2.5, 3 hours a day for the last, every day for the last 2 years. They don't even remember the last time they actually took a rest day. And they may tell you also that they battle fatigue or chronically tight muscles, like, oh, my hamstrings are always tight. I don't know why. I'm doing as much stretching as I can. They might hit performance plateaus or even regressions despite all their effort, which leaves them really frustrated. They're like, I'm putting all this time in the gym and I'm not getting any stronger. And honestly, sometimes these are the athletes that can be even more challenging to work with, getting them to buy into the idea that they need to actually take a break in order to perform better can be a really difficult concept for them to accept. Our bodies don't get stronger on the days that we go to the gym. Our bodies actually get stronger on days that we allow it to recover from the stresses we put on it. So every person's rate of recovery is going to be a little bit different depending on other things that are going on as well. You can be affected by things like their nutrition or their diet, their sleep habits, their stress levels outside of the gym. Remember, from a physiological standpoint, exercise is ultimately a stress. The body is taking it as a stress. It's a good stress. We enjoy it. Well, most people do. But, when somebody's using exercise as a stress relief, you need to make sure that they understand that their intensity level may have to decrease in order to accommodate for those other stressors in their life. Maybe they have a really stressful job, they're working long hours. And they think, oh, I just need to go to the gym and just leave sweat on the floor everywhere because I need to get my stress out. Their body's going to react very differently. From a metabolic standpoint, you're still releasing all those chemicals that perceive stress and threat. So being able to educate them is going to be really crucial. Otherwise, they're just going to be breaking their bodies down continuously. Giving them options, doing breathing activities to downregulate that nervous system response, getting rid of that fight or flight. Maybe doing something at the very least, performing an active recovery segment of some sort, 20 to 25 minutes of intentional, slow paced movement as an alternative to maybe that 5 rep max back squat that's up on the board or sprint intervals, something super intense. So it really is about educating these clients and getting them to understand and buy into the fact that if they kind of step back, they'll be able to go forward that much more.
Have you ever found
So,
yourself
yeah.
in a situation where um, you had to reduce the number of training days, say in a given week? Do you think it's better to allow the client or the athlete to choose their cadence and then just work with them on emphasizing recovery between training sessions?
You know, I have. I've had to take, maybe somebody who's been training for the games or some high level competition coming up, and they're just grinding themselves into the ground. They're training 7 days a week, and have to be like, look, we need what you've done so far is not working, right? That's why you've come to me for some assistance. So what we need to do, what I suggest, we need to cut your volume. Maybe you train 5 days a week, have one active recovery day, and then one complete rest day. And that rest day is not, hey, I'm just going to go hike for 5 miles in the mountains. That's not a rest day. So communicating that clearly to them is very important. That, hey, rest day is truly a day of recovery and allowing your body to get stronger. But to your question, yes, I have absolutely taken days away from training, even though, initially I want to take away as little as possible. But if there's a glaring issue that their recovery balance is just not where it needs to be, then it's like, hey, let's step back. Let's let the body kind of calm down and recover. And then we will progressively start loading you again. But we need to not make the same mistake that led you to needing my assistance in the same place, at the same time, rather.
Mhm.
Right. So it's breaking some of those habits and some of those, that mental game, especially with my high level athletes. And hey, you don't have to be training 7 hours a day necessarily. What if I told you you would perform better if you trained 2.5 hours? And those are like your professional athlete kind of training schedules. But
Mhm.
if you could get the same amount of work done, or being very intentional and focused on your work, really working on your weaknesses and getting a job done in 2.5 hours instead of 7, that opens up like a whole other aspect of life for them, and
Mhm.
having them perform, because ultimately they want to perform at their best. They want to feel good. They want to be the fastest. They want to be the strongest. And, changing that mental aspect of training for them can be very difficult sometimes, but it is worth the effort.
Mm.
And honestly, it can be just as challenging for that type of a person as it is to get, say, a couch potato to get up off the couch and start training for a marathon. So
Mm.
you really do have the two extremes, but ultimately it comes down to the same general process.
Yeah.
So as we go into the very top of our hierarchy here, we get up to that piece labeled as, skill and motor control. And this is traditionally where a lot of coaches started their coaching cues from. They say, okay, well, that squat looks a little funky. Let's clean it up with, cues like, you tell them chest up or hips down, knees out, toes forward, or turn out, whatever you give them, insert your favorite cues to try to clean up the movement. And this kind of goes along with that overhead squat assessment we talked about earlier, without taking into consideration first all the other layers that you built to get up to that high level skill. You'll just be throwing darts with a blindfold on and hoping you hit the target, right? You're trying to cue a problem that might be rooted in something deeper. However, if you've already found out that the athlete has the range of motion needed, they've gone through this flexibility, you've checked off mobility, they have the range, they can access that range, it's balanced in that strength, and they're allowing their body to recover appropriately. Now this is the moment really where you as a coach have the confidence in your traditional training drills. Great coaches have great drills and they'll be most effective. It's like riding a bike. There's all these pieces to the objective, right? When you ride a bike, there's pedaling involved, there's holding the handles, you have to produce enough power to move forward fast enough, you have to balance the bike, and you have to steer it and know how to brake, right? There's all these pieces to riding a bike. So motor control drills and this skill refinement drills help to put all those components together to refine that skill and like actually make the bike move forward. So that's really what it comes down to, is trying to get coaches to think from the bottom up in this hierarchy instead of the traditional top down kind of method. I think it avoids a lot of the frustration in figuring out, okay, well, am I programming the best exercise for my client? Is it really what they need? And having a process to go about, have that objective data to pull from and be like, yes, this is what this person needs. This is where I need to focus our efforts in order to start solving some of those higher level problems. coming up with that functional diagnosis. So it's just really about that assessment. You're assessing, you're no longer guessing. And the idea that you never want to stretch a strength problem. And ultimately, you don't want to overlook the recovery aspect, because no amount of additional programming you can give an athlete will fix that volume recovery issue. So just learning how to prioritize your efforts and really giving your clients the best solutions to the problems that they're having. So that's what I've got for you.
So the hierarchy of needs, does it work like a sequence, or is it like is there more emphasis on one of these than the other? So, for instance, if I look at your pyramid, flexibility has the largest amount of space. Does that mean that it's the most important, or does that just mean that it's the first one in the sequence and therefore it's important?
You can almost think of this like a checklist, working from the bottom up, so that flexibility, think of it, if you don't have range of motion available to you, if you have less than 90 degrees of hip flexion, for instance, there's no way that you're going to be able to squat down below parallel, right? So it becomes addressing the fact that there's a flexibility issue at that joint that you need to address before you're trying to force them into a full depth squat. Does that make sense? So if you have the range available, then your next step is, okay, well, can they control that range? Do they bounce out of the bottom of that squat? They don't have full control of that full depth of range. And kind of working your way, flexibility is good. They have the range of motion available, up to mobility. Can they control? Can they access all of that range of motion? Example would be like shoulder abduction. We have a lot of folks who they get about here and they're like, that's all I can go. A coach comes along and helps them up here, and it's like, okay, well, they have the range available to them. It's not a passive range, it's not a flexibility issue. It's just that they don't have the strength to get their arm up overhead. They can't access this range of motion because they lack the strength. So if it was a flexibility issue, you would address it one way. But because in that instance, it's a strength issue, now you're focused, instead of stretching on the band for 20 minutes before class, now it becomes, let's strengthen you, make you stronger, push you in that position, do an overhead carry or an overhead hold to strengthen that range that they couldn't access previously.
So, with that being said, is it more common to see folks with better flexibility than mobility? Is that kind of a universal truth because you have some sort of external force applied to it?
You'll never have more mobility than you will flexibility,
Mm,
right? So if flexibility is it available? Can that joint possibly get into that position? Or are there
mhm.
things blocking it? Are there anatomy issues, bony blocks? Maybe they have arthritis and they have some bone changes that prevent further range of motion. That would be a passive range issue. That would be a flexibility issue that you may have to consider, and stop trying to force them into a position that their body won't allow. So it's about recognizing that possibility when you find flexibility issues. But mobility issues, obviously, if there's flexibility issues to start with, you're going to have mobility issues just by the fact that the range isn't there. I can't possibly move actively in that range if it doesn't exist in the first place.
So, the flexibility test, in a way, is answering, do I have a flexibility issue or do I have potentially a strength issue? That's kind of what it gets into.
Exactly, because that's going to make a difference whether you stretch something or you strengthen something.
Mm, mm,
So a lot of times, like I mentioned, that flexibility, mobility, those two terms get thrown around interchangeably all the time.
mm.
But in reality, those two terms require very different interventions per se.
In your opinion, what's harder to fix, a flexibility issue or a strength issue? So, for instance, getting people strong, as long as they adhere to your program and they emphasize their rest and recovery, it seems like most trainers and coaches are pretty confident that they can get someone stronger. But
Mhm.
flexibility, is it easier, harder? How would you look at that?
It depends. That's going to be the famous
Yeah,
answer. It just depends.
yeah, yeah.
Depends on the type of flexibility restrictions that you come across.
Mm.
We go through this hierarchy basically in an hour in our course. So obviously I don't have all that time for today, but going into the types of flexibility restrictions that you'll find, listening to what that client is telling you as you're putting them through a flexibility mobility screen, that's going to help direct you as to what type of intervention you choose, what type of exercise that you're choosing. Somebody who feels a tightness, that it's going to be more musculotendinous type of tissue that you're going to have to address. Something musculotendinous is going to respond very quickly versus something that's actually a bony block, which will never respond. It's certainly worth, but there's potential things for like scar tissue, bony blocks. Maybe it's a high school basketball player who sprained their ankle 100 times 10 years ago and have all that scar tissue built up. And so you're looking at changing things on a joint level, and knowing that when you're going through your assessment is going to change what your expectations are for that tissue to change. Something muscular is going to change much quicker than something joint related. And having the understanding of what expectations I can have and communicate with my client about what they can expect, how long this is going to take, and whether it's going to change, or what are the chances of it changing are. So certainly there's some flexibility issues that you try and try and try, and you don't make any headway. That's where it then becomes the conversation with them, be like, hey, you know what? Your ankle is obviously very fused up. Maybe you have somebody with a lot of arthritis. They have those bony changes that, unless you're a surgeon as well as a coach, you're not going to go in and you're not going to change the bone structure, right? But if somebody only has 90 degrees of knee flexion, then putting them down or trying to force them into a full depth squat is only going to result in compensations elsewhere, right? So they're going to start to do some really things. They might shift away. They might put extra pressure on their hips or their lower back. Or, I've seen a million different compensations for what one particular issue may be. You're much better off, depending on what that client's goals are, catering to a position that their body and their anatomy are going to allow them to get into. So it really comes down to client goals and expectations as well.
Perfect. I have a question from the audience.
Sure.
Are you familiar with the sling system?
The sling system, so like posterior sling, that type
Um,
of.
Maybe they can expand on it, but the question was, would the sling system be relevant to strength balance assessment? Is it something you assess with your athletes?
So I think if I'm understanding correctly, or if I believe what they're referring to is kind of those posterior slings. So a relationship
Hmm.
between, say, the left hip and the right shoulder.
Hmm.
It hopefully that's what they're referring to. Um, I don't necessarily test slings, but you do end up finding out. You might see some of those patterns show up. You might have a stronger drive through your left hip and a stronger press through your right shoulder. So you might see some of those patterns pop up as you would in a clinical sense, and thinking about it in terms of slings. So it's very, very possible, but we don't test slings definitively.
Hmm. When it comes to your strength balance assessment, if you were to break that into its own hierarchy, does it even have a hierarchy? Are there some balances that are worth assessing and testing more than others?
I mean, what I like to think about is I want to gather as many data points in my strength balance testing as possible. And obviously, I might be able to. I like to cater it to that client in particular, depending on what their goals are. If you have somebody who's coming to you and purely from a performance standpoint, like, hey, I just want to get faster, I want to perform better, I want to get stronger, then I'm going to test everything I possibly can. I want to get as many data points as possible to give me really a better, clearer picture about the overall situation. Because you could very well have a strength balance issue in a hip that's driving now a shoulder irritation. I'm driving harder through my right hip, and now suddenly my left shoulder is irritating. So if you're only programming according to that shoulder and you missed the hip strength issue, you're focusing on the wrong area. You're not getting to the root of the problem. So that's why I like to gather as many data points in my strength testing as possible. But you know, having said that, I will tailor certain strength testing according to what I'm hearing from the client, what their goals are, what does their past training look like. So I might only choose maybe a step up and a carry for lower extremities, or a lower back patient. I want to include something upper or something lower, depending on how much time that they have to commit to the testing process. I'm always going to say the more data we collect, the better picture that we were able to paint. Does that answer that question?
Yeah, it does. It kind of helps explain that strength balance testing is not like some universal test. It's certainly contextual with who you're working with.
Absolutely. I mean, and we have a group of exercises that we'll go through, and we'll spend 10 days testing, doing a full testing segment with a client.
Really?
Just to kind of get a clear picture about what their body's currently capable of doing. The more data you can collect, the more you can compare to later and really see how they're progressing over time. So, you don't want to miss those underlying things when you're programming. You want the big picture, because I've seen some really strange patterns happen as a result of something I may not necessarily originally have thought it could happen, but I've seen it happen, and then we address it and it gets better. So you could
Yeah.
have an ankle flexibility issue driving a shoulder pain issue, and their only complaint, it's not I can't squat, it's my shoulder hurts.
Yeah.
But ultimately, if I skipped those lower layers, I would have missed it.
Does active life prescribe to the notion of like rehabilitative exercises or corrective exercises? You hear those terms a lot. And whether you subscribe to that notion of thought or not, how do you integrate movements or drills or interventions that are meant to address, say, mobility issues? Is this something that you separate as like separate from the training session, for instance, like the primary lifts, or do you integrate them into your training sessions, like in between primary lifts sets, for instance?
It kind of varies by client, honestly. I mean, any movement really can be considered a corrective movement.
Mm,
You could use a testing segment, for instance, that step up I've mentioned a couple of times. You could use that as an intervention. So your test became your exercise now.
mm,
So if we want to work on strength balance of that right leg versus left leg, we're going to do the movement that you tested as weak, and just seeing that carry over. So, it really comes down to that idea that all exercise is corrective. It's just about making sure that you're dosing it correctly, you're assessing, you're choosing the exercises that apply to that situation. The client that you have in front of you. What problems do they have? Okay, this exercise is going to be appropriate for that finding.
no. And that example, the step up, for instance, that would be appropriate in a situation where, say, strength deficit was the issue, and you're training for strength as opposed to the different intervention, for instance, that would be flexibility.
Yeah, I mean, a step up is a great test to test a lot of different areas of strength. It's not just the hips that you're testing, right? With a step up, it's also going to kind of take a look at some thoracic ability to go into extension and hold that position, that front rack position. It's going to take a look at how well you control your body in this kind of a plane, too. You have this ability of the hip to stabilize. Can they perform that movement to begin with? So I think that, yeah, the step ups. Let's see if I could answer the question here. So it just becomes one of those things that, we take a look at a lot of different things with one particular test. So it's not
Yeah,
just testing one
yeah.
particular
I
aspect.
I, I definitely oversimplified it. That's for sure. Uh,
It comes with
um,
experience and knowing how to start being selective, and you
mm,
gravitate towards exercises that you find you've had success with a lot in the past too. So
mhm.
there's that aspect to it as well.
What would it look like if a coach worked on skill and motor control at the top of your hierarchy, while at the same time overlooking the previous steps in the hierarchy? Would the risk in that involve, say, injury, or is it less dangerous than that? Does it just mean that you're working with athletes who are deficient in certain movements and just don't get the results that you want?
I do think that it becomes more of an effect, like whether it's effective or not. I think it becomes an aspect of time devotion as well. Are you wasting your time giving cues that are just not ultimately going to fix the problem? It's
Mm,
that funky looking squat that you're trying to tell them, get your butt down, get your knees apart, turn your toes out or turn them forward. trying to give all of these cues. And I feel like it's not necessarily an injury risk in that aspect, but it can be a very frustrating situation for both the client and the coach. The coach
Mm.
wants to do right by the client and they're just doing what they think is the right thing to do. But if they haven't gone through and kind of checked off the other boxes and all these other prerequisites to performing that movement that they're trying to refine, that skill, that complex skill, then they're just going to get frustrated. So I don't think it's necessarily a safety aspect, but I do think that it is um, a frustration aspect from both the client
Yeah,
and the coach perspective.
yeah, yeah. Have you had to, say, battle clients where that had to address some of these steps that are lower on the hierarchy? For instance, this probably happens with male clients more often, but if someone comes in and, they think they've lifted a few weights, but they have some deficiencies in your assessment, do you kind of have to talk them off the ledge into coming back and addressing some more fundamental things that might not be necessarily what they enjoy doing? For instance, if someone likes the back squat and you think you need to kind of rebuild the car from scratch, do you have those conversations?
Oh, absolutely. I mean, at the end of our assessment portion, I always have a check-in call with the client to kind of go over the results, kind of soften some of the blows, especially if I have somebody who's used to being highly competitive. It's
Hmm.
about educating them on, hey, you know what, this we're playing the long-term game here. You're coming to me because you want to perform better. You're also coming to me because in 20 years you still want to be doing this. It's that short-term sacrifice mindset for that long-term gain. And it really becomes just this continual conversation with your client, reminding them of why they came to you in the first place. Why are they training in the first place, and unpeeling those layers, and always bringing back the intention of why you're doing what you're doing with them, and the importance and how it can carry over into the goals that they've established with you.
When it comes to exercise selection, you talked about how this is essentially a framework for exercise selection. You're totally right. There's no shortage of exercises out there for coaches to choose from. Kind of a personal question: have you found yourself recently um, changing your position on certain exercises? As you've been training folks a long time. Do you ever have revelations about exercises that you used, or things that you thought that turned out to be not as effective or not as true as you thought they were?
I mean, certainly, I mean, when you've been around and in practice for over a decade, things change all the time, right? When I
Mm,
graduated PT school 14 years ago, practice looked a lot different than it does today.
mm,
Um, Certainly, I mean, there's some old, tried and true exercises that will just work forever just because they do. But certainly there are times where literature comes out and it does make me stop and think. And even more so than that, I look at, have I had success with this particular exercise over time? Have I found this worked for countless clients in the past? If it has, great, I'm going to continue utilizing it. But maybe if I'm starting to dose it and I'm not getting the results that I would really want to see, then of course I'm going to second guess it and be like, is there something better that might be a little bit more effective? Or what is it about this exercise that I'm not getting the results that I need? Do I need to dose it differently? Do I need to make them do it more frequently? So it becomes about the dosing aspect of that particular exercise, even more so than the exercise itself sometimes.
mm, mhm, mhm. And last question for me, and we'll see if the audience has any more. But on the aspect of recovery and coaching recovery, I get the sense that clients and athletes, when they step into the weight room to participate in the volume and the stress, that maybe the weight room in the gym is kind of like your domain. That's where you write the program for them, and they get it and they do it. But when it comes to recovery, it's almost very personal in a way. What time you go to bed, your routine before you go to bed, what you choose to eat and drink. These are very personal domains, right? So, do you find yourself kind of being like a behavioral therapist as much as like a coach when it comes to the recovery aspect? Do you have those conversations? Like, how do you know, how far to kind of push into someone's personal domain when it comes to the recovery aspect?
Certainly. I think that some of it has to do with the personality of the client itself. I'm kind of a people person in general, so I have a tendency to kind of be approachable, I think, with clients. But I think it is about developing rapport with them first before you kind of go diving into their personal life, right?
Mm,
So you're not going to just be like, "Hi, I'm Coach Kate, so by the way, what'd you eat for breakfast this morning? That when that's not really the way I go about things. But if you are developing that rapport, they're coming to your gym, or they've been working with you for a little while, and they start to open up and let their guard down a little bit, and that they're suffering in some way. They're not performing the way they want to, or you've talked about, oh man, my shoulder's really been acting up lately. That's where you as a coach can kind of start to unpeel those layers a little bit and be like, hey, well, how long has that issue been going on? And understanding and allowing yourself to be vulnerable with them and starting to really appeal to their personality, understanding maybe what their communication styles are like, to be able to allow them to let their guard down and let you in on some of their more personal habits, if you will, because it really does require those honest and vulnerable conversations to happen for you as a coach to have the biggest impact on them.
Mm.
So I think, it definitely is a process. Sometimes it's easier than others. I mean, sometimes you'll have a client that'll just spill their guts the first conversation you ever had. They're like, wow, I didn't know that I was going to get your whole 10-year history in the first 5 minutes of our conversation. But,
Yeah.
there are people out there that are like that. And others, you kind of have to, I mean, they're a stone initially, and you kind of just have to let them soften over time. And that just comes with effective communication and allowing them to know that, hey, I really truly do have your best interest at heart here. Let me in if you want some help. If you have interest in changing that situation, let's go through this together. And being on their team and allowing them to know that, hey, I'm not here to judge you, I'm here to help you.
Mm. And is that one of the most important, or if not the most important part of the volume and recovery balance is having those conversations? Does it make it harder to do your job without having those conversations?
Oh, absolutely. I mean, it comes down to the communication aspect of it and allowing them to know that, hey, this person really, my coach really does have my best interest at heart. They want me to be able to do better. They want me to be able to feel better. So you know what? Maybe I should go ahead and listen to them. Maybe I should start making some smarter food choices. Maybe I should start to get into a better sleep habit, and that will help me recover and be able to reach, help me move closer to my goals. So it's all about goal establishment, that communication, and understanding the benefits of recovery, and the idea that, hey, if I do take a rest, I allow my body to recover appropriately, I am going to reach my goals.
Mhm. And in active life, do you educate trainers on how to communicate results and outcomes to your clients? Of course, you're going to have clients who see the changes for themselves and they're very grateful. And then, of course, there are going to be people who, want to see or need to kind of see it, right? See the results or be proven. Is that part of your assessment and testing process? Is also to take some time to look at the results over time, the improvement, and communicate to a client that they are improving, in fact?
Absolutely. I mean, there are those clients who need to see the numbers. Like, I want to see how much weight did I do 8 weeks ago versus today. They need
Hmm.
those those mile markers, right? And they need to see the data on the paper. Other people are perfectly happy with just how they feel. How do I feel
Hmm.
now versus 8 weeks ago? You know what? I feel like I'm squatting with a lot less discomfort. Or hey, I just flew through that AMRAP with a lot greater ease than I did it the first time 3 months ago. And
Hmm.
they everybody has their own measure of success, right? So that's one of the things that we established in the beginning is, if we are to work together and we're working towards this goal, what does success look like for you? And that's going to be a very individual kind of perception.
Yeah, and for a lot of folks, quality of life is certainly that's what people want to feel better. What they're talking about, quality of life,
Hmm.
energy to play with kids, and so on. Do you score that some sort of way? Do you survey clients? Do you have them be conscious of how they're feeling outside of the gym or the weight room?
Absolutely. And a lot of times, as far as progress goes and communicating that progress with them, sometimes we as a coach have to allow them to realize that they really are progressing over the course of time. So for instance, I had a client recently who was crying every night because she couldn't fall asleep because her hip was bothering her so bad. She was waking up at 2 in the morning and just laying there crying because she couldn't sleep. And, a few weeks into 3, 4 weeks into working together, it was one of those things. Well, how do you feel? Oh, about the same. Well, how are you crying at night anymore? No, I'm not. Like, I'm sleeping through the night. Oh, you know what? Oh, that's great. And
Mhm.
having them realize, like, oh, you know what? I really am getting better. Like, I'm not exactly where I want to be yet, but I am progressing more than I realize on the surface. So
Yeah.
sometimes it's our job as a coach to kind of bring those facts to light as well. And that's all through these conversations that we have. You're taking notes like, okay, could not stand up from the toilet without searing back pain.
Yeah.
And now it's like 6 weeks in, you're like, hey, how's getting up from the toilet? It seems like such a simple thing.
Yeah.
But and then we're like, oh, I haven't really thought about it.
Yeah.
Okay, great. So maybe even though maybe your numbers haven't changed a ton, but the carryover into real life is there. And so it's important to highlight and celebrate that fact.
Yeah, because physical equilibrium, it's not like an endorphin rush. You're not going to feel it and be a 10 out of 10.
You're
But
like, "Yay,
certainly
I
an
PR'd my toilet sit,"
yeah, yeah, right. Yeah, it's true. It's true. So just getting people to realize that, and especially for folks who deal with acute and chronic pain, yeah, it is a
Mhm.
massive improvement.
It's the impact that you can have on somebody's life when you really kind of dig deeper. It's really amazing. It's why I love what I do.
Mm. Um, we're going to conclude it there. I think we've taken all the questions that we've gotten from the audience. But Kate, obviously, Active Life is your company, and folks can find them very, very easily. But if folks wanted to keep up with you and what you've been doing and talking about, how can folks do that?
Well, I do have an Instagram handle. It's at kdowd underscore DPT. Also, they can follow Active Life RX on Instagram. We have a few different Facebook groups. There's the Active Life Coaches group. There's the Active Life Professional group. That you can always find out information there. And I'm always kind of perusing through those groups too. So if there are questions that come up, you can always get a hold of me there. Otherwise, I mean, my email specifically is drkate at activeliferx.com. You can
Mhm.
certainly shoot me an email if you have further questions, and I can kind of direct you where is most appropriate.
Perfect. And since we have a few more minutes, can you talk a little bit about the immersion course that you teach at Active Life?
So the immersion course is designed for coaches who are looking to kind of further their education, and it really dives into some of the details that we kind of I give you a very abbreviated version of the information today. The immersion course is a 13-week long course where you go into kind of the how-tos, how to bring somebody through one of these assessments. How do you evaluate somebody's flexibility and their mobility and trying to decide where to go specifically with interventions and exercise selection. Being able to develop yourself as a coach to make this your profession. So, we go into a few points on the business aspect of things, how to host a workshop, how to really be a professional coach as opposed to a coach doing a side gig. So, it's really upping your game as far as being able to teach coaches and give them the tools necessary to be able to start solving some of those higher level problems. It's not negating the need for the medical community. I mean, I'm a clinician and I fully support what we're trying to do with Active Life. It's about getting coaches the ability to have the tools to help to bridge that gap between formal medical care and going back to the gym. So
And
this
without
yeah,
without being too, I guess, abrasive here to the medical community, in a way, they've kind of negated, the aspect that Active Life is filling in. They are the medical community is happy to tell people to stop participating in things that they enjoy in order to address something like acute and chronic pain. But Active Life is trying to basically extend and put more effort into letting those two things kind of be compatible.
absolutely. And there's no reason why we can't play nice in the sandbox. We want to be able to provide a way for individuals to stay healthier. Telling somebody to stop exercising altogether because it's bad for their health is kind of, I don't know, it's not really the way we want to go, right? As
Hmm.
a general population, and I mean, there's such a sedentary kind of epidemic going on, especially amongst COVID, where now all of us are sitting at desks. at home, really not getting the activity that we need. So we really want to make activity as accessible as possible. We want people moving again. We want people not to be scared to go to the gym. We want people to be able to go into the gym and know that their coach has their best interest in hearts. They know how to keep them safe and healthy, and how to, be able to keep them going, and not feel like, oh my god, I'm going to go to the gym and I'm going to get injured.
Yeah.
Somebody who's had rotator cuff surgery, I can speak because I have. I've had
Yeah.
rotator cuff surgery. So, they go back to their doctor on their final visit, and their doctor's like, all right, cool. You don't have to see me anymore. They're like, well,
Yeah.
can I go back to the gym? They're like, yeah, just ease back into it. Well, what the
Yeah.
hell does that mean? So, the immersion process teaches coaches how to approach that situation safely. So when they get that person who's been discharged from physical therapy because their insurance ran out, which happens all too often, unfortunately. Or
Mhm.
maybe they're doing an activity and their therapist might have been really great in their specialty, but they have no idea what to do with a barbell athlete. Not all PTs are created equal. We all have our own little specialties, right?
Yeah.
So it's allowing the coach to be a part of that building process.
Yeah. What I love about active life is that it is coaching. And the whole point of a coach is to move someone out of their comfort zone. Injuries tend to make people, it sounds ridiculous, but people get comfortable in their injuries. They tend to identify by them, right?
Mhm.
And they become emotional about them. And it's a limiting factor that's part of their identity. And what active life is doing is applying that coach aspect. Let's work through this. Let's get you to attain the next level of achievement despite your injury. That's what I love about it. And that's where I think active life is creating, is filling in that gray area that has existed so long, where the medical community want to address it and then the coaching community wasn't really allowed to address it as well.
Exactly. So we're really trying to build coaches up so that they feel more confident and able to handle those type of situations. So
Hmm.
it's necessary. I mean, we have to take some of the excuses away from people and like, oh well, I can't work out, my knee hurts. I'm just not going to go to the gym. Well, what about your other three joints or your other three limbs? So,
Yeah.
but they have to feel confident in the person's ability to be able to keep them safe. I think that that's probably one of the biggest things that I've seen for folks who have stopped going to the gym. Like, oh, last time I went to the gym, I hurt my back.
Hmm.
Well, I went to the doctor and he told me never, don't do any snatches or don't deadlift. I'm like, really? Okay, so did he tell you not to pick up your bag of groceries from the floor too? Oh, well,
Yeah.
no, he didn't say that. Well, what's the difference? You're
Yeah.
holding a bar versus a bag of groceries.
And quite frankly, are the doctors thinking about their patients' health outcomes 20 years from now? They probably won't see that patient 20 years from now. I don't know if that's necessarily what the medical system is doing in terms of their perspective, is thinking long term. It's very much a profession that relies on remedies, right? And we as patients have gotten used to that as well. We won't get into Western medicine into a whole new
Mhm.
webinar, but the cure and the remedy has been prioritized for a long time over other things, preventative and interventions that have a long term timeline and a long term impact.
Definitely. I think, even more so than, doctors neglecting to think about the future. I think a lot of times what happens is, physicians have this do no harm part of their
Hmm.
oath, right? They don't want to do any harm. And I think, unfortunately, a lot of physicians just don't know what advice to give. They don't know what to tell somebody who's used to deadlifting 400 pounds who just had back surgery. They're like, I don't know. They don't know the advice to give. And so it's not
Hmm.
really them trying to hold somebody back. They just don't have the information or education necessary to be able to tell them how to do that safely. So that's really
Yeah.
where we're coming in, and we're trying to change that in our system today.
It's a real opportunity for coaches. It truly is, and it's always exciting. It's always exciting to do an event with Active Life, and I really enjoyed this with you today, Kate. Thank you for doing this. Thank you for coming on.
You're very welcome. Thank you so much for having me, Hewitt.
Thank you, folks who are in attendance, and mostly to the folks who will be watching this later. I hope you enjoyed it, and we'd love to hear your feedback on this content and what kind of content you want to hear from Active Life in the future. So, with that, we'll conclude today's presentation. Thank you again to Kate. Thank you again to our attendees, and we'll see everyone soon.
Take care.